once he opened up that area, I can remember there was, I think 3 dentists present, and one of the assisting dentists, when they opened up that site, I can remember saying, I've never seen anything like that in my life. So I think whatever they saw in there, it must not have been pleasant. I think it was, from what I hear, what they told me, it was just basically just like rotting bone.
Yeah, it was just, it was one dentist, but I think it was 2 assistants were in there, or 1 or 2 assistants, and yeah, they just hadn't seen bone that hadn't healed over like that. But then again,
it was just a big hole in my face.
Yes.
Where the socket was, where the wisdom teeth were, it was just a big hole, and it was all disgusting, infected. It was just a mess.
Yes, it was like just a hole. It was a hole in the bone, and inside the inside this, and this is from wisdom teeth extractions. People think like you get a wisdom tooth. A lot of people develop things called like dry sockets and stuff like that, and those are also infections. What people aren't aware of is that once you have a wisdom tooth extracted, it's not common for a dentist or doctors or anybody to go back and see that that has healed up properly. And this is what leads to something called a cavitation. And a cavitation is basically infected bone that never heals over and creates this kind of open area for bacteria to grow.
Yep.
And Kevin had a cyst growing in there, which was never picked up. It wasn't picked up in all of the CTs we've had done on his head and MRIs that we've done in regular hospitals. Nobody ever picked up on this cyst growing in his face.
Yep.
So, so that's touching base on those 2 things. The other thing was you had mentioned in the first video that you had your amalgam fillings removed, and that you had them removed safely. What are your thoughts on that, and what does it mean to have your amalgam fillings removed safely?
Yeah, there's definitely some things you need to consider before you even attempt to do that. I mean, for myself, that was the first thing that I did. With all the procedures that I went through, I went and took my amalgams out first. Right. And I didn't...
Why would somebody... Sorry, let me just cut you off there, but why would somebody want to remove their amalgam filling? Like, why would you have to, or why are these silver fillings an issue in the first place?
Well, half of it is mercury. That's what's in them. Half of it is mercury, and there's nickel and a lot of other heavy metals in there that are quite poisonous to the body. Right. And it's just a source of constant toxicity that's sitting in your mouth. That it goes into your saliva, it goes down into your digestive system, and it goes, circulates throughout the body, and it's just a constant dumping of toxicity every day. Like
and only to mention that actually lends to poor microbiome and killing.
Destroys your microbiome and among other things. So it's kind of a crazy thing that we've done. Right. One thing, those amalgams, they're strong. Like they'll last forever. Right. That's one thing for sure. But they're just the studies have shown that those things are just a source of heavy metal toxicity, basically. Right. There's one book that I read that's called Amalgam Sickness. Okay. We can flash that book on the screen.
Yeah. And we'll definitely include any of the things he mentions in the description below.
That was an eye-opening book for me to read because it covered amalgams in detail, but it covers all the symptoms and all the diseases that they've shown that are linked to that. And it's every one that exists.
Right, pretty much.
Everything.
Yeah.
So it's just, why would you want to keep that in your mouth? But at the same time, you need to be pretty precautious on trying to take these things out of there.
Right.
So you need to find a good dentist that is trained to do this.
Okay. And what do you mean by a good dentist? Like a holistic dentist, or is
there's
some of them? Or
a biological dentist, like a holistic dentist, would be a good idea. I mean, there's a lot of them doing it now. Right. Back when I did it, it was maybe 1 or 2 or 3 of them in Ontario. Right. So there wasn't that many of them. But they just need to be trained in this because there is a protocol for this, right? Right. A lot of dentists will claim they can do it. And they'll just go in there and they'll drill it out and send you home. Mm-hmm. But it's more than that. You got to really pay attention to what you're doing. A dentist really needs to have their facility equipped for this, right? They need to have the room kind of staged in such a way. They have the ventilation set up properly. They got all the equipment that they need. They got the rubber dam that they shove in your mouth to make sure that everything's all kind of sealed off. All the dentist and the hygienist, they take their own precautions too, because once you start drilling some of that stuff out, it goes airborne. But it's one thing you gotta find a dentist to be able to do all this stuff. So you need to do your research. You need to make some phone calls. Scope the office out, make sure that it's set up properly, and ask questions.
Right.
And then at the same time, you need to really do your own personal assessment too to see if it's
somebody you can work with and somebody that's going to be able to work with you, right? So
exactly. And you need to do your own kind of personal assessment too as to whether or not you're ready for this.
Right.
So there's so many factors that kind of feed into this too. It's a personal judgment call. If you're really, really, really struggling with your health, you have a chronic illness that's really taking its toll, this may not be a wise idea for you.
Right.
Because this will rattle your immune system big time.
Right, because you're going to stir, we want people to know that you're going to stir things up. So if your elimination pathways are not ready to detoxify this heavy metal, this could potentially cause a worse issue, because you could be allowing this mercury to actually redeposit itself in other areas in the body. And the way that our bodies work is they tend to put toxins in an area that your body is going to be, I guess, at least affected by. So if you stir this up and you have this mercury in one part, and then all of a sudden ends up in places like your brain or like heart or any of those places, that could be a major issue, correct?
Yeah, exactly.
Right, okay.
Once this mercury kind of starts to go mobile too, once it starts to become airborne, when you start drilling it out, that can just be, driven right back into your tissues. Right. From a lot of different variables too, right? From, the lighting situation, there's all kinds of things that can contribute to that. So you gotta pay attention to that. That's something you need to assess too, to see that your body can handle that. Right. For me, I went through it. It was the first thing I did. I went in head first. It was by some of the advice that some of the dentists told me. Mm-hmm. I didn't really question it, and I did it, and I didn't feel good at all after. I felt like I just didn't feel good. Right. So now that was like 5 years ago, probably now, right? I like to think probably most of this mercury is kind of finding its way out, right? Right. But I'm sure there's still some there. Right. Some, probably, most people, I've heard some people say that most people deal with this for life. Right. It's kind of a natural detoxification process that your body tries to go through for the rest of your life, because it's not easy to pull mercury out of your body. It's not. No, it's mercury and lead are probably the two heavy metals that are the hardest to pull out of the body. Yeah. So, okay. So you need to take some precaution with that. Mm-hmm. Okay, so although at some point we do think you should assess that and potentially work with somebody to trying to eliminate these heavy metals from your body, because we both struggle with heavy metal toxicity. For me, it had nothing to do with dental procedures, other issues, but that's another story altogether. In your last video, you had said something about being able to provide a little bit more evidence as to why people should consider looking at your mouth if you are suffering with an illness. Can you kind of elaborate on that? Maybe perhaps name some of your mentors, people that you're following or people that you've worked with, things like that along those lines. Yeah, with root canals, that's probably an easy one to start with. This goes back probably almost 100 years ago now. Weston Price, he started to do a lot of work on this. Right. He started realizing that what we're doing in the mouth wasn't so good. This might have been a factor to some of the illness. So he started to study some of the root canals, and he started to pull root canals out of people's mouths and kind of implanted some of those root canals into tissues of other animals. Right, I remember this. He started doing all these crazy things, and he was finding that some of these other animals were becoming sick. Mm-hmm. So he did from a root canal tooth that was implanted underneath their skin. So if I can include that study, I will link that somewhere below or on the screen as well. So if you look at all of his work, he's really pioneered a lot of it. Another mentor of mine was Dr. Hal Huggins. He just passed a few years ago. He kind of dedicated his whole life to this. Right. He struggled with illness himself. I think he had multiple sclerosis. I think he was diagnosed with. Right. And he had root canals. He had mercury amalgams. He had them all. Right. And he got rid of them, and it helped him big time. Right. So he's been an advocate ever since to kind of help people, and he's spread awareness about root canals and how they could lead to these illnesses or be misdiagnosed as these illnesses, such as specifically MS is one that keeps coming up with root canals. Yeah. If you have root canals and you're struggling with MS, please,
find somebody that you could talk to and look at the possibility of the fact that that could be an underlying infection that's happening in a root canal that is then, made its way into your spine or into your brain worse yet, you know what I mean? So.
Yeah, so he's pioneered all kinds of research on that. And there's a protocol out there, it's called the Huggins protocol. You're starting to do root canal removal.
Right.
And even, cavitation removal and stuff like that. He's formulated some protocols on how to do that properly.
Right.
And a lot of it's been well adapted around the world from that too. So he's pioneered a lot of that. Dr. Thomas Levy, he's another cardiologist. He's done a lot of work on anything dental related to do with heart disease.
And that's the other thing, right? Like heart disease there is a major connection between having poor oral health and having heart disease. It's something that's actually already, it's discussed amongst Western medicine.
Probably 4 or 5 other books that I've read personally myself from other dentists that are just kind of, naturopaths and things like that have done their own research trying to help their patients, and they're finding, some of the stuff they're doing with their patients on getting them well has to do with fixing their dental issues.
Right.
And just touching base back on root canals again too. One of the biggest thing that they found with root canals is that you can't sterilize a root canal.
Right.
It just can't be done.
Right.
I mean, they'll argue that you can, but when you look inside the tooth, it's kind of filled with all these little dentin tubules, these little stringy dental floss type material that goes inside the tooth that you can stretch out for miles.
Right.
And you can't sterilize that 100%.
Because they're saying it's absolutely impossible to get to every single one of those tubules in order to sterilize it so that bacteria won't grow, right?
And you gotta just think about it, like you're cutting off the blood supply to the tooth.
Right.
The nerves are gone, the blood supply is gone. It's just a piece of flesh that's kind of
a piece of dead tissue, basically.
A piece of dead tissue that's kind of sitting in your mouth, and you can't sterilize it 100%. So what's going to happen?
It's going to rot, and it's going to develop. It's going to develop bacteria, and it's going to rot, and that's
when you cut off the life force to some tooth like that. I mean, nature has its way to it's going to start to kind of decompose itself.
Correct.
And that's what it's doing. Even if you get as much sterilization in that tooth as you want, as long as there's no blood supply and kind of this life force coming to this tooth, it's just going to decompose anyway.
Yeah.
And that doesn't matter what you do.
And that was kind of
the thing. It's just going to slowly rot. Oh man, it's crazy.
Yeah, and that was kind of the thing that we found with Kevin. Like, he had 5 root canals, and every single one of them, I can't imagine that this is a coincidence, every single one of them were mush when they pulled them out. They, on the surface of the tooth, they looked completely normal, but as the dentist was pulling each of these out, under it was just mush. So it already had started, all of them had started to decompose. And when we sent those off, we sent off a little smear.
It was these two teeth down here that were root canal.
Yeah.
Actually, what they found in these 2 teeth was that when they did the root canal, they left roots inside my tooth.
Oh my God, yes, that's right, that's right. And I know somebody else that happened to too, that they said that they had done a root canal, but the tooth didn't have, the tooth had 2 roots, right? Instead of one.
Some teeth are kind of crazy
kind
like
of
that.
weird.
They have 2 roots, they have 3 roots, sometimes you really need to pay attention to that. And mine was kind of a weird type of tooth that had an extra root going off to the side that they missed. So it was a piece of root that was just sitting in my face, rotting away, along with the rest of the tooth.
Right.
It's just a mess.
It was a mess. And even just to touch base, and I will include, again, somewhere in the description below or on the screen, that some of the bacteria that they find in these root canal teeth are horrible things. Like, we're talking like streptococcus, and we're talking things like gangrene. Like, these are major infections. These are not like, you just have a little bit of like a tiny little bit of infection that's happening. These are things that could lead to detrimental effects.
One study I found that if you have a root canal in your mouth, it can paralyze your immune system up to like 70%.
Yeah.
And some of the infection that they're finding in root canals is what they equate to being very similar to what botulism is.
Wow.
Have you ever heard of that before?
Yeah.
So this is serious stuff.
Yeah.
Imagine that stuff that's just leaching in your tooth, and then once in a while, it might be able to drop down in your tissue and somehow get in your blood and then circulate around and
you've just
migrate to your heart, and who knows what can happen? Who knows? It's just
and it's
crazy.
Scary. It's a scary thing to think about, and one of the reasons why we're discussing this today, because we're not here to scare you in any way, but we do want you to pay attention to the things that you have going on in your mouth, especially if you're dealing with a chronic illness, just because that could be the primary source of where that illness could have been coming from. It's just an underlying infection, perhaps. Again, that's not set in stone, but it is something to consider. So with that said, I think I have one more question for you, and the last one is, I just want your final thoughts, because everybody knows that, I'm struggling with autoimmune disease and Lyme, and you're struggling with a very severe case of Lyme, or worse, struggling with a very severe case of Lyme, not so much anymore. But how do you, what's the connection here? What's the connection, or how do you perceive the connection between Lyme and dental infections and things like multiple sclerosis? Because that's what Western medicine was telling us, is that you were going blind and having all these problems because of MS, but it wasn't.
For me, it kind of progressed. I started with lupus, and then it kind of progressed to ALS, Gehrig's disease, and then it was kind of final beginning stages of multiple sclerosis. That's where it was. Right. And then I kind of took my own route, and I started to go from there. But it was when I found the Lyme doctor who actually diagnosed me with Lyme disease, he said he wouldn't even consider treating me or doing anything with me until I dealt with all of this. Because he knew, I told him. He's like, that was one of the first questions he's asked, if you had any dental work done. Yes. He asked me to bring all my x-rays and everything with me, so I showed him, and he looked at it all, and he's like, the treatments and stuff that we can do here, there's no point. Right. You need to go and get this dealt with.
And why was he saying that? He was saying that...
Because he was saying that everything, like I think it was on the first video we looked at, I had about 2 pages of infections. Right. Lyme was one of them. That was not one that was the biggest problem.
You had a lot of what we would say classified as co-infections, but some of these things are not even just co-infections. They were just viral, bacterial, parasitic infections in general that could have been potentially coming from his mouth, right?
Yeah, so exactly, and that's exactly what he said. Right. 90% of those were from here. Yeah. Right in here. From in there. The rest of it kind of migrated around my body and kind of, settled itself out and, into other places in my body, but it was all there. Right. So, and this Lyme doctor that I found, he's been treating Lyme patients for almost 4 years. Right. He knows some of the big ones out there, like Dr. Klinghardt. He knows him personally. Yeah. Good friend is. Right. And the two of them say that that's the big thing that you really need to address, because that's just the huge source of all this infections. And you have to think, like, you're trying to fight something as serious, and we will discuss the severity of Lyme disease, because I think a lot of people are misconstrued by how serious Lyme disease is. People think, or I shouldn't say Lyme's disease, I always say Lyme disease is. People think you can take 30 days of antibiotics and it's gone, you know what I mean? Like, no, if you catch Lyme disease right in the beginning, yes, 30 days of antibiotics could be beneficial. But in most cases, people with chronic Lyme are going to struggle well beyond that. And I guess just to kind of wrap this up is, like you were saying, Klinghardt, like kind of a world-renowned He's been
world-renowned doctor.
The world-renowned doctor in this one here too. So he's got he's had Lyme disease too. Yes. So
he had Lyme, and he's saying you need to address your dental situations, right?
Those are the people I see too, is those that have actually struggled with this disease are probably the ones that you want to talk to, right? Right. And he has, and he's had most of the protocol and most of the stuff that I went through to kind of go through what I've done to get myself well. There's a lot of stuff he preaches. Right. So I went through it all, but the big thing was the dental issues. Right. And I can finally say, after about 5-6 years and a lot of money, unfortunately.
And we did all of this stuff here, all of your surgeries and stuff. We did a lot of that stuff in Canada. We did have to go overseas for other stuff, which we will get into at a later date. But we have found another clinic out of Mexico recently that does all of this stuff for basically like a quarter of the cost. So if I can find their information, I will link down to it below. And if you are somebody that's seriously considering it, I would seriously consider getting on a plane and going over to this clinic.
I would totally do that if I knew about this
now. If we knew about it now,
You go down there, they will book you all, like in kind of a couple days. They'll stagger you throughout a few days, depending on how much you have to have done. Right. And get a little hotel in Mexico and make a little vacation out of it.
I don't think you're going to make a vacation out of it when you're doing all these surgeries.
It's an alternative, because it can be quite pricey, but I'm telling you, if you're struggling with your health, and anybody that has Lyme and anybody that is watching this that does have Lyme will know that
there is no price that you can pay.
Brutal illnesses that exist on the planet. Period. Right.
Okay, with that said, I think we're going to wrap up this interview for today, and I would hope that you would come back next week and join us again for another video. And if you haven't liked and subscribed to our channel already, please go ahead and hit that like button and subscribe button. The subscribe button is the little heart that you see on the actual video itself. Again, I'm Jessica. This is Kevin. We're the Healing Hands duo, and I guess we'll see you next week. Oh, sorry, something else that I just wanted to mention. If there's anything else that either of us can answer, of course, please leave a comment below and we'll try to get back to all of your questions. On the other hand, if there is more information, always check our descriptions below because we'll try to link to as much of the information as we discuss in our video. Again, thank you so much for watching. Bye-bye.